Well, no one investigates like News 4. It's a growing problem that knows no boundaries and can happen to any family.
An alarming number of newborns are being exposed to drugs taken by their moms during pregnancy. News 4's Luke Moretti has more on how hospitals are trying to treat these defenseless victims. Luke?
Yeah, you know, over the last decade, there's been a massive increase nationally in the number of drug-exposed infants, and some hospitals are busy caring for these tiny victims of a growing drug abuse problem. Newborns exposed to addictive prescription painkillers or heroin dependence while in the mother's womb.
They can be inconsolable, they scream.
Within 24 hours, babies begin to exhibit signs of drug withdrawal, known as neonatal abstinence syndrome.
They're so frantic that they have difficulty bottle feeding.
Dr. Thomas Riley, director of neonatology at Sisters of Charity Hospital, has seen his share of drug-exposed babies.
We've definitely seen more over the past probably 5 years.
Anywhere from 100 to 200 babies a year, he says, monitored and or treated for neonatal abstinence syndrome. He says the treatment of choice these days is morphine.
We give them just a small amount of morphine with each feeding, and then wean that about every 48 hours, depending upon what their scores are in the neonatal abstinence scoring system.
From 2000 to 2009, the number of infants diagnosed with drug withdrawal nationally nearly tripled, according to a study co-authored by Dr. Stephen Patrick.
And by 2009, we found that there was about 1 infant born per hour in the United States having drug withdrawal.
The study also found that the cost to care for drug-exposed babies dramatically increased from $190 million to $720 million over the same decade.
All too often in our healthcare system, we react to problems, just like we do in the NICU. We react to a big problem of prescription opioid use. But if we could use those dollars more upstream, perhaps we could prevent. It would not only be cost-saving, but also prevent harm to both babies and their mothers.
Rena Das-Eiden, a senior research scientist with the University at Buffalo, says not a lot is known about the long-term effects of newborn drug withdrawal.
Are babies who experience more severe neonatal abstinence syndrome, more severe withdrawal, do they have a different picture in terms of long-term outcome than others who don't? And we don't know.
There's also a stigma attached to mothers who give birth to drug-exposed babies.
Often they're ashamed about their situation and feel bad about that.
Dr. Richard Blondell is an addiction expert with the University at Buffalo Department of Family Medicine.
There are some people who view the drug-dependent mother as an abusive parent, a neglectful parent, and want to take criminal action against them or take their babies away. And I think that that actually prevents women from coming forward and getting help.
Some states have become tougher with prenatal drug abuse. In Tennessee, for example, new mothers could end up in handcuffs. It's an approach that some in the industry don't think will do the newborn or the mother any good.
It's easier to judge a woman for using a substance than it is to offer, to understand that it's a complex phenomena and there are a lot of barriers to getting treatment for a woman.
Dr. Riley of Sisters Hospital finds that moms are generally open about their drug use.
Then there are the moms that deny it, and if the baby has significant symptoms, we'll do a urine toxicology on that baby to try and identify if that baby has been exposed.
Do you have to report?
We do not have to report moms that are in programs and have negative tox screens and are under the care of a physician that's prescribing the medication, whether it's Subutex, Suboxone, or in some cases Lortab for a very specific reason.
Right.
We do need to report the mothers that come in and have not obtained a legal prescription or on any of the illicit drugs.
Now, we have an interactive map of the state showing county-by-county breakdown of hospital discharges of newborns with the drug-related problems.